I rise in support of the Swalwell Amendment, which protects rape victims, sexual assault victims from the harsh denial of justice that they would suffer if this underlying legislation is passed. And I would note that my colleague from Iowa has talked about the costs to the healthcare system and the access to the healthcare system that is impeded by those costs. But I would point out that my colleagues on the other side of the aisle are united in wanting to repeal the Affordable Care Act, which they derisively call Obamacare. They want to repeal it. It makes health care more affordable. It has enabled 30 million people, when you factor in Medicaid coverage expansion, it makes health care accessible by 30 million, for 30 million people, but they want to repeal the Affordable Care Act instead of repair it. That's been something that they've been talking about for 6 years. And out of 6 years, we get to the time where we've got Republicans in control of the House and the Senate and the President. We've gone 40 days into this session and still don't have a piece of legislation in place offered by my friends on the other side of the aisle to repeal and replace. So if you're going to repeal and replace, you've got to introduce some legislation. There's not been one piece of, not even a sentence offered in the House of Representatives or in the Senate to repeal and replace. And if you're going to repeal, all you got to do is say, legislation, just one line. We officially repealed the Affordable Care Act, also known as Obamacare. Boom. Take a vote on it and it's done. But the reason why they don't want to do that is because they know that it will hurt Americans. They know that it will deprive Americans of their ability to access the healthcare system, 30 million of them. And it'll also hurt the millions of others whose benefits were made better by the Affordable Care Act. In other words, no bans on pre-existing conditions, no lifetime caps, no yearly caps, free annual wellness checkup, all of the closing the donut hole for prescription drug prices that have hurt our seniors so badly over the years. These are the ways that we have protected the ability of people to access the healthcare system. And I laud my friend from Iowa for talking about accessibility and affordability of healthcare, but tort reform is the exact wrong way to go about doing that. Tort reform protects the pocketbooks of malpractice insurance companies, of big healthcare conglomerates, of health insurance companies. It protects them, but it protects them by taking away your right to be able to seek redress when there is medical negligence that occurs to you and your family. You'd be barred under this legislation significantly from being able to pursue your just claims. And the reason why is because it doesn't benefit the big insurance companies for you to do that. So it's not really a matter of anything other than protecting big business at the expense of consumers. And I would just ask my colleagues to think about what we're doing with this legislation. We could be spending time passing a jobs bill, passing regulations to protect the health and safety of innocent women, children, babies, elderly, but instead we're trying to snatch rights away that are guaranteed under state law and have been guaranteed by federal law. With that, Mr. Chairman, I yield back.
Mr. Chairman. The chair would advise the members that there is a vote on the floor.